Hello po sir, I am Januine Monsanto and today I'll be demonstrating the perineal care. So it is a process of cleaning and washing the genitals and the anal area with plain water and or medicated solutions to maintain the perineal hygiene and comfort. This is most especially after childbirth. So its principles first is to provide privacy and dignity of the patient and to do the process or the procedure from the cleanest to the dirtiest. Now for the its purpose, is to cleanse the area of secretion and excretion, to reduce the unpleasant odors, to aid to avoid any potential infection, and lastly is to provide comfort. Now for the equipments that we will be needing, first we need the bath blanket, the waterproof underpads, the 4 washcloths, the 2 towels, the basin as well as the warm water, the gentle soap as well as the paper lining, the linen bags, the kidney basin with paper lining, as well as lotion, but this is only optional. Now proceeding with the procedure, first we have to check the patient's chart. So by doing this allows us to ensure that we are doing the right procedure as it is verified by the doctor. So we have to check the patient's chart. So the procedure is safe to perform as it is verified by the doctor. And then after that, we have to identify the client and explain the procedure. So, maayong buntag ma'am, ako po si Nurse Wayne. Pwede ba ko mangutana sa imong pangalan, sa imong edad o taga-asa? Thank you po. O karon ang buhaton nato ma'am kay ang paagi sa paglimpyo nato sa imong tinatawo sa likod o sa atubangan. Okay lang ba na ma'am? Okay, so by identifying the client allows us to be ensured that we are doing the right procedure in the right patient. And by explaining it to them, the procedure that we'll be doing, we can actually encourage them to participate in the said procedure. Therefore, it would be easy for us nurses to do the process. And then after that, we have to wash our hands thoroughly. So by doing this, we are breaking the chain of infection and we are preventing the bacteria or any microorganisms, and we could avoid them throughout the process, which in this case is the alcohol-based hand job or the ADHR. And then after that, we have to prepare the completeness of the equipment. So by doing this allows us to have a continuous process because all the equipments that we will be needing is already in place. And then after that, we have to bring the equipments bring the preparation to the bedside. So by doing this allows us to have, it also helps us avoid any unnecessary movement that could possibly lead to cross-contamination. And then after that, we have to provide patients privacy. So by doing this we are actually letting the patient know that she is safe and she is well respected. So we have to close the curtains if there are curtains. And then we have to close the door if there is a door. Okay. Okay, and then after that, we have to adjust the bed in a comfortable working height, and then we have to lower the side rail in which the nurse will be working on. So assuming that we are adjusting the bed, and then we are lowering the... And then after that, we have to drape the client using the back blanket in a diamond shape. And then we have to roll the top sheet towards the foot of the bed. And if the top sheet is already soiled, so we have to gently take it off and then place it with the paper or the linen bags. So by doing this, allows us to maintain the dignity and the privacy of the patient. So we have to drape the client using the bath blanket in a diamond shape. And then we have to roll the top sheet towards the foot of the bed. And then after that, we have to position the client in a dorsal recumbent position, ensuring that the perineal area is still covered. So ma'am, mag-change na position po. Pataas lang nato imong tuhod o ibuka na to gamay. Okay lang ba na ma'am? Okay po. So by doing this allows us to have a better access towards the perineal area. And then after that, we have to check the water temperature using the back of the hands or the back of the hands of the nurse or the elbow. So we have to use the back of the hands than the front or the palms because the palms already have calluses, and therefore the back of the hands or the elbows are more sensitive to feel or to have better sensation to the water temperature. So we have, and the water is mild and warm. And then after that, we have to don gloves. So we have to don gloves. So the gloves will help us protect or will serve as another layer of protection against the bacteria or microorganisms that we perhaps encounter throughout the process. And then after that, we have to place the waterproof underpads. So we have to place, ma'am, pwede ba ka makatakilid gamay po kaya para mabutang nato ang waterproof sa bed po. Okay, ma'am. So, takilid lang tagamay po. And then, i-place na to siya sa ubos. Okay na po. Balik na po. Okay. And then after that, we have to remove the adult diaper or the sanitary pads, and then we have to roll the contaminated inside, and then wrap it with a piece of paper, and then place it with a paper lining. So, ma'am, i-remove kaon na to, no? Kaon na to ang imuhang diaper po. Okay lang ba na, ma'am? So, kaon na to siya. Takilid lang po tabalik, no? Then, pag nakuha na nato siya, kuha siyang roll. And then place it with the paper. And then after that, we have to wash the first washcloth in the kidney, in the basin, or in the kidney basin, and then we have to place or put a gentle soap all over the washcloth, and then with the use of the dominant hand, we have to fold it in 4 parts. So we have to, then we have to, then we have to place we have to put the gentle soap all over the washcloth, and then with the use of the dominant hand, we have to fold it into 4 parts. So the water and the soap or the gentle soap allows us to get or to take the bacteria accurately or appropriately away from the patient's perineal area. So by folding it into 4 parts allows us to have a clean surfaces in every stroke. So, and then after that, we have to expose the perineal area only, but folding the corners of the bath blanket. So we have to fold it in the corners, expose the perineal area only. So limited exposure again maintains the dignity and the privacy of the patient. So now we have to begin cleaning the labia majora with 1 downward stroke starting from the mons pubis or mons veneris towards the bottom. So by doing this, by wiping the front to back, allows the bacteria to get wiped. We are avoiding also the bacteria from getting into the urethra. So, ma'am, magsugod na ko hugas sa imong kinatao po. Mag-start ko diri adap dito sa gawas. And then after that, we have to flip the washcloth to expose the second clean area or clean part. And then we have to do the same procedure or the same thing to the other side of the labia majora. So by doing this, allows every part or every side of the labia majora to get clean. So we have to expose the second part, and then we have to do it again with the other side of the labia majora. Okay. And then we have to flip it again to expose the third layer, securing it properly with the thumb. So securing it properly with the thumb allows the clean or the clean surfaces or area to avoid getting contact with the soiled surface. And then after that, we have to inform the patient that we'll be going to spread the labia. And then with the use of the non-dominant hand, we have to gently spread the labia. And then with the use of the dominant hand, we have to wipe, in one downward stroke, we have to wipe the labia minora. So ma'am, ako ang ibukagamay ang imuhang sulod sa imuhang kinatawo po. Okay lang ba na, ma'am? Basig maka-feel ka of discomfort, mananghid lang ko daan. Sige pa. So, spread na to, ma'am. Dali ka sa side. And then we have to expose it again to expose the fourth layer, and then do the same procedure with the other side of the labia minora. So this allows each side of the labia minora to get cleaned properly. So, sa pita sa ma'am, no? And then lastly, using the back of the washcloth, so we have to spread the labia, and then we have to wipe the midline starting from the clitoris towards the anus. So we have to, yan, and ma'am, ako ang spread na po balik, ma'am, no? Tapos mag-start po dali sa taas, padulong sa ubos. So by doing this, we are ensuring that we are getting the remaining discharge in the perineal area. And then after that, we have to dispose the soiled washcloth towards the paper lining under the bed. Okay. And now, we have to wet the second washcloth, but this time it should have no soap, only water. Then, we have to flip it again to 4 parts with the use of the dominant hand. And then, do the process or do the same procedure from steps 16 to 22. So, ma'am, magbalik ko og trapo sa imong tinatawo po. Mag-start today sa labas. Flip na ko usab po. Sa other side. Flip na to balik. Spread na ko ang imong labia minora, ma'am, ha. So, balik. And then, on the other side, because, and then with the use of the back of the washcloth, we have to balik na to og spread ang mohang midline, ma'am. Dasugod sa clitoris, padulong sa. And then, we have to dispose the second washcloth again to the paper lining under the bed. So, by using the water only allows the patient to feel warm and avoids irritation. And then after that, we have to, using the dry towel, so we have to pat dry the perineal area only, starting from the top towards the bottom. So, mag-place ko karon og dry na towel, ma'am, no, sa imong tinatawo. Tap, tap, tap. So, then we have to dispose the used towel into the paper lining under the bed. So, why do we have to pat dry or to dry the perineal area? It is because the microorganisms or germs usually accumulate or usually grows in a moist areas. And then after that, we have to cover the perineal area. So, by doing this, again, maintains the dignity and the privacy of the patient. So, ma'am, ako po nang ibalik ang imuhang back blanket po, no? And then now, we have to reposition the client in a side-lying position, exposing the buttocks. So this position allows us to have a better access of the buttocks. So ma'am, magtakilid lang ta pa, no? Para sa imuha na pagtang likod, maglimpyo. Okay lang ba na, ma'am? So, magtakilid ta. Taas na to ang itong kamot. Butang na to sa shoulder ang isa. Itaas na to yung isa kong tiil. Then, ang talikod ta po. And then after that, we have to wet this third washcloth with the and then we have to lather a gentle soap all over the washcloth, and then with the use of the dominant hand, we have to flip it again into 4 folds. So, again, and then gentle soap, then flip it into 4 parts. And then after that, we have to begin washing the outer part of the buttocks, starting from the bottom to the top in one stroke. So, ma'am, magsugod na tapo, no? Dili at mag-start sa taas. So, stop to the bottom. So why? Why do we have to start from the bottom to the top? Because we are following the principles of this procedure or this process, starting from the cleanest to the dirtiest. Then after that, we have to flip it again to expose the second area or second surface, and then we have to do the same procedure from the towards the other side of the cheeks of the buttocks. So ma'am, dali na po sa imuhang baba na dapita sa imuhang lubot. Okay. And then after that, we have to, by doing that, allows each side of the buttocks to get clean. And then after that, we have to expose it again to expose the third layer. And then this time, we have to spread the cheeks of the buttocks to clean the inner side of it. So, ma'am, ako ang spread gamay ang imuhang cheeks, and then para makina to ang imuhang sulod. So, this allows the bacteria from the inside to get wiped out, and be vanished. And then after that, we have to expose, the fourth layer, and then do the same procedure with the other side of the inner part of the buttock. Spread na to balik, ma'am, ang muhang lubot sa ubos na part para maklean na to ang sulod. And then after that, we have to fold it again, and then we have to place it with a paper lining under the bed. And then after that, this time, we have to wet the fourth washcloth, but again, at this time, it should have no soap. It should be water only. So, wet the fourth washcloth, and then fold it into 4 parts. And then repeat the same procedure from the steps 28 to 32. So, ma'am, balik ko na ko. Dali ata mag-start sa lubot, sa taas. Dito na to. Sa pikas na po ka, ma'am. And then, i-spread na to para ma-expose ang tunga. Then, ang pikas na po. And then, after that, we have to place the soiled washcloth towards the paper lining under the bed. And then, after that, using a dry towel, we have to pat dry the perineal area, moving from the bottom to the top. So, ma'am, ako ang i-dry ang inyong tap, from the bottom to the top. And then we have to place this used towel towards the paper lining under the bed. And then after that, we have to apply lotion, but this is only optional. And then after that, we have to place or put back the clean diaper or sanitary pad, and then we have to remove the waterproof underpads. So, magbutang ko diaper sa imuhang lubot tapit, ma'am. And then, ako ang kuhaon ang waterproof pads. So after that, we have to position the client back in a supine or semi-fowler position. So ma'am, balik na ta po. So by doing this, proper position allows the patient to have a comfortable position, avoiding any back pain or pain in the body that could possibly lead to discomfort and stress. And then after that, we have to remove the bath blanket and then put back the top sheet. But we have to take note that if the top sheet is already soiled, we have to take it off and then place another one. This is to maintain the cleanliness of the procedure for the benefit of the client as well. So we have to gently take it off. And then we have to place back the top sheet. This is to maintain the dignity of the patient as well as the privacy. And then after that, we have to adjust the bed from what it was prior to the process or the procedure. This is again to ensure that the patient is in the right position to avoid any pain of the body that could lead to stress and discomfort. So we have to adjust the bed again, and then we have to raise the side way. And then after that, we have to bring the equipments that we use towards the utility room, ensuring that it is ready, or these equipments are ready for the next use or for the next procedure. So we have to bring it to the utility room. And then after that, we have to doff the glove or remove the glove. And then after that, we have to perform hand hygiene. this is to maintain the cleanliness, not just with the client, not just within us, but of course with the environment that we are in. And then after that, we have to document the procedure done, because I believe that in every procedure that we do as nurses, what is not written or what is not documented was not performed. And then after that, we have to document is how to document what? And then we have to show the nurse's notes towards the instructor. So by doing this allows us, we are letting the instructors know that we are doing the right procedure, and then we really accomplished properly the process or the procedure. So thank you so much, sir. That ends my presentation or my demonstration. I hope that I did it very well, and thank you so much for your time. Thank you.